In an earlier module, we looked at how sanitation service delivery depends on an enabling environment that sets the policy and legal frameworks, assigns and coordinates institutional responsibilities, and plans and controls activities in the sector. Now we'll look in more detail at making the enabling environment work effectively. So let's take a hypothetical situation, but one whose individual elements are all taken from our experience in different countries over the last 40 years. You can download this as a 2-page case study from the course resource package. In the city of Sanitown, a major project rehabilitated and expanded the sewerage system and built an additional treatment works with aerated ponds. It also built a fecal sludge treatment plant and equipped the municipal authority with vacuum tankers for fecal sludge. A few days' training was given to the responsible municipal sanitation department staff 5 years after the project ended. The central area, comprising 30% of the city, is served by a sewerage system. But only a third of the population living in the area are actually connected to it. 4 of the 6 sewage pumping stations are dysfunctional and overflowing. The new sewage treatment works is being bypassed because the electricity has been cut off due to massive arrears in payment, and only a fraction of the sewage is treated. 25% of the population use simple pit latrines, which are covered when they are full and safely abandoned. But 7% of the population still practice open defecation. Unregulated private tankers are dumping about half of the fecal sludge they collect in the river. The local authority vacuum trucks are out of use due to a lack of spare parts. Manual emptying is on the increase, especially in the dense, unplanned settlements, and fecal waste is being dumped into the drainage ditches. The fecal sludge treatment plant is choked with sludge and provides only minimal treatment. So only about 30% of the city's fecal waste is safely managed. As the consultant is designing a program to rectify the situation, you have carried out a city service delivery assessment, as described in a previous module, to find out why the situation prevails. A quick look at the CSTA shows that the project failed due to a weak enabling environment. Here we've grouped the questions underlying the CSDA into 3 clusters, shown on the left. In the 2 columns on the right, we'll summarise where the issues examined by the CSDA are affecting sanitation outcomes. The institutional and policy issues act at a high level. In this case, the sewage system is managed by a municipal department. It lacks administrative and financial autonomy, and so it cannot make decisions on how funds are spent or acquire staff or equipment. This has knock-on effects. For example, delays in clearing a major sewerage blockage resulted in overflow, erosion, collapse, and breakage of a sewage pipe. The legislative framework does not recognise non-sewage sanitation at all. Indeed, the pit latrines used by 75% of the population within the urban area are illegal. The lack of legislation means that it isn't possible to regulate the emptying services, which are therefore informal. Finance, planning and demand creation directly affect the ability of service providers to do their job. Lack of funds means that they can't buy essential inputs such as electricity or spare parts. And a lack of a clear plan backed by publicity means that few households are connected to sewers or upgrade their on-site facilities so that they can be hygienically emptied. The third set of questions in the CSDA focus more directly on service provision. Lack of technical capacity means that services are poor or non-existent. For instance, electromechanical equipment is poorly maintained, leading to major breakdowns requiring expensive repairs. Poor management of the municipal vacuum trucks has left them broken down and being gradually cannibalised for spare parts. And although an international NGO has demonstrated how the manual emptiers could upgrade their services to an acceptable level, there has been no programme to train and equip them. The generally poor quality of sanitation services causes gross downstream pollution, making the prawns caught nearby unfit for human consumption. Failure to consider the needs of the growing informal settlements has led to an increase in manual emptying as the only available alternative. Here is a question for you. Given this background, what sorts of interventions do you think would be a priority in Sanitown? So what sort of interventions did you come up with? Sanitown illustrates some typical ways that sanitation services need an improved, enabling environment. Each situation is unique, but there'll always be a need to improve aspects of the enabling environment to deliver sustainable and inclusive sanitation. Some commonly needed interventions, which are also relevant to Sanitown, are listed here. Each of them is discussed in turn, looking at what you, as a consultant, would need to do and who your main partners would be. Of course, as we've emphasised throughout, you'll also need to consult other stakeholders. Policy and legislation often need revision to include non-sewered sanitation. Some examples are given here. You may also need to develop advocacy approaches to influence some stakeholders if there is resistance to recognising non-sewered sanitation. There are many advantages to an autonomous sewerage and sanitation utility or department. What is possible in practice will be constrained by the wider policy and administrative context. Effective non-sewered sanitation requires on-site facilities that contain fecal waste and allow for its hygienic removal. This requires standards or guidelines for containment and effective enforcement. Enforcement is often a challenge. In designing interventions, you'll need to give attention both to the capacity of environmental health staff and the incentives for them to actually carry out enforcement. Providing equipment and opportunities for training and professional advancement may help. We'll look more at funding in another module. In this context, we can note that this involves balancing user willingness to pay with resources available from other revenue streams and the sale of reused products. As well as piecing this together, you'll need to work with the entity responsible for regulating tariffs on a model for determining prices. Increasing sewerage connections requires an understanding of why people have not connected. It may require a sustained marketing campaign designed by specialists. You should also examine ways of reducing the upfront cost to the user, for example, by including some of that cost in the monthly tariff. Improving the technical capacity of the sewerage operator is a medium to long-term activity. It is important to design an ongoing support mechanism which might be anchored at the national level. You may also need to support restructuring the city-level sewerage operator to accommodate non-sewered sanitation. Phasing out manual emptying is a priority, but there may be an ongoing need for emptying facilities inaccessible to vacuum trucks. A win-win solution is to design a program to develop the manual emptiers into recognised small businesses using more hygienic methods. This has been done in several countries. Similarly, there will be a need to design a system to license previously unregulated vacuum trucks. You may consider combining this with, for example, straightforward licensing procedures, technical assistance, and facilitated access to capital. These are discussed in the module about working with the private sector. This diagram reflects the one at the beginning of the module on how services fit into the enabling environment. It summarises the activities you'll need to undertake to develop the common interventions that we've been looking at, and the principal stakeholders that you'll need to work with. In this module, we've looked at how the enabling environment affects sanitation services, and the sorts of interventions, and the main stakeholders that you will need to work with. Fixing the enabling environment is as important for a successful project and delivering services as fixing the toilets. Thank you for watching.